Hi everyone, and welcome to the Wellness Connection. I'm Dr. Mark LeMay. I am a applied clinical nutritionist and a chiropractor for the last 28 years, and today we're going to be talking about a subject that is, you could say, a little controversial, because I know that most of my patients that come in to see me, they're like, "Hey, Dr. LeMay, did you get your flu shot this year?" And I'll tell them, "No, I don't get the flu shot." And they'll ask me the question, "Why?" And then I'll ask them the question back, "Why do you get a flu shot?" So this is, again, a topic that I want to get people to just kind of think about what you're doing, okay? Don't just take the advertisers for their word. I want you to know what's going on. So today is going to be a good conversation. So if you can see me, give me a thumbs up, and also let me know that you're there. And then also, as we're going along here today, because I'm going to be asking you 5 different questions, I want you to comment on these too, okay? So let's start off, because today's episode, which is going to be a great one here, it's called about the 5 common myths about the flu shot. So let's go to myth number 1. And just to give you an idea here, I took all this information from very reliable sources, okay? So I'm going to cite my sources as I'm going along here so you know exactly who they are. So the first one that we have here is the common myth number 1 is flu shots are safe. So, this is right out of the Physician's Desk reference for 2010, 2008, and I just want to let you know that what they put in the flu shots are a couple things, and some of you might know this and some of you might not. One of them is thimerosal, which is mercury, which is a neurotoxin, and some of them have aluminum in there, again, which is another neurotoxin. And it's like, for most adults, even in small adult doses like that, it's not really bad for adults, but it's really bad for children, because their immune system and their body's ability to block those things from getting into the brain is not there. So they're especially vulnerable to those kind of things. So even at minute amounts like that, still they're neurotoxins, way more than that you're supposed to be getting. Some other things that they put in there is like formaldehyde. And for some of you who don't know, formaldehyde is typically used for embalming, patients after they die, or people after they die. So when I was in chiropractic school, I did a year's worth of, cadaver work so we could learn how the body works, and it was all in formaldehyde. And I tell you, that is not some fun stuff. Okay, the next thing is, just want to let you know, there's different things that they put in there too as adjuvants, which again, they put in their antibiotics, and they put other things in there too. So if you consider those things to be safe, then okay, go ahead and get the flu shot. But I don't consider them to be safe. I don't want those in my body. So again, I just want you to know what's there. So educate yourself. So, is there any other things that that are in the flu shot? Send me some information here. Make a comment here. Put something down below. I'd like to hear from you too about that part of the myth. Okay, so got somebody who's actually got something.
What's a neurotoxin?
Oh, neurotoxin. Somebody asked a question about what's a neurotoxin. So let's just take like mercury, for example. A neurotoxin is something that will destroy a nerve. So it binds itself to the nerve and destroys the nerve. So that's what a neurotoxin is. So it damages or destroys nerve cells. So that's a neurotoxin. So aluminum's a neurotoxin, mercury's a neurotoxin. So good question. Okay, let's go on to let me just finish up something here, because this is a quote from the CDC, the Centers for Disease Control and Prevention. It claims that there's a 44% success rate for the flu vaccine. So you can actually go on the CDC and check that out. So it can be anywhere probably like 44, and I think the most I've ever seen is like right around 50%. So it's 50-50. Myth number 2, flu shots are effective. Okay, so I'm going to go to another reference here, and this is from the British Medical Journal, and they found that when it comes to the influenza vaccine, and this is a quote from them, it says that evidence from systematic review shows that inactivated vaccines have little or no effect. Most studies are of poor methodological quality, and there's little comparative evidence exists on the safety of these vaccines. And that was back in October 27th of 2006. That was the British Medical Journal. So it's not like this is new information. It's been around for quite a while, that they're not that effective. And here's one of the reasons why. And I'm going to explain a little bit about this. Because every year, again, viruses are something that mutates every single year. So what happens when you get the flu, and again, the sicker some people are, the more this actually speeds up the process as far as viral, what's called, it's like a gene, what do they call it again exactly? A gene amplification. So every time somebody gets the flu, it actually moves through the population and changes. So it's not the same every single season. So that's one of the things that makes this so difficult for people to actually, try to get it and then try to do something to make a vaccine from it. Because even they say, and this is, again, a great quote here, it says, the flu vaccine supposedly contains some versions of the causative agents in a weakened form, but by the time the virus is isolated, cultured for manufacture, and distributed to the population, the current strain of virus has usually changed to a form completely unaffected by the vaccine. And Michael Decker, MD of Advantis, the flu vaccine manufacturer, laments, and this is a quote from him, by the time you know what's the right strain, you can't do anything about it. So it's like, it's already mutated. It's gone on to the next thing. So it's like you're giving them last year's and it's already this year. So it's something totally different. So yeah, it would stop the one from last year, but it's the new one now. Okay, so has anybody ever heard about that before? I mean, I'd like to hear from you too. Has anybody else heard about that? Because again, that's the big thing. It's just like if we're already behind on that, it's almost like you're trying to catch the wind. So it's like it's just about impossible to get these viruses and get a vaccine that will actually prevent this year's because it's already changed. So has anybody heard that before too? So let me know if you've heard about that before too. Okay, so question.
So flu vaccines mutate every year?
Flu vaccines mutate every single year. That's what they do. So yeah, that is correct. So that's why this is such a difficult thing. And I can understand from the scientific standpoint, you want to do something. But again, it's like if it's always constantly changing all the time, why don't we do some things that'll actually help build the immune system so we just don't get them versus trying to give people what they've already had. Okay, so that's the main thing for me. I just want to get people thinking about it. If it's already impossible and the manufacturers are saying it's impossible to do that, then what are we doing currently? Are we just stopping last year's, which most people probably have already had? So again, that's what I want to find out. So okay. Let's go on to the next one. Myth number 3. Flu shots build the immune system. Okay, now let's take a look at it again from a standpoint of just like how do people get the flu? So most people get the flu because you can remember viruses and bacteria are ubiquitous. And I remember how my instructor when I was in school taught us about how people get the flu. He said you opened up the window and influenza. It's like it flew in the window. So it's in the air. And I remember doing in microbiology class, we took these blood agar, which are sheep blood, and you'd open them up, the brand new ones, and we just had us wave those in the air when we were doing this, and then put them back together, and then we stuck them in the incubators for 48 hours to see what would grow. So we didn't even put anything, we just wave it in the air like that, and we came back, we all had bacteria growing in our blood agars. So again, it's just like bacteria and viruses are ubiquitous. So we get it by getting it on our skin, breathing through our nose and our lungs, in our eyes, all those different things. So yeah, you come into contact with them. So that's how we normally would get a virus. But when you do a flu shot, what you're doing is you're bypassing, because these things have to go past all of our defenses to get to us, inside of us. But if you just inject it directly into the body, you're bypassing all those things. And again, I don't think that's a really good idea to be doing because you're actually, in my opinion, this is just my opinion, that you're not doing our body a favor by doing that. Okay, it's like it can get this on its own by just letting it do its job. So, question again, Michelle?
How many strains of the virus are there every year, and are masks covering your mouth effective?
To a degree, that's a good question. So if wearing a mask, is that effective? It will help prevent getting through the nose and the mouth. That's correct. But it's still going to get the eyes and your skin. So you're still going to get it that way too. So again, you're protecting, some main areas like nose and lungs. That's good.
It just... Okay. Sorry.
Okay. Sorry, everybody. We just kind of lost contact there just for a second. But the question is like, how many strains are there each year? Again, it can be 1, 2, 3. A lot of times they have to just check to see what people are getting because they just branch off. Okay, and so it's like you can have 2, 3, 4, 5 different strains of virus every single year, and it depends upon what part of the world you're in too. And then, what was the other question, Michelle? I'm sorry.
Yeah.
Okay.
You already answered it about mask.
About the mask. Okay,
Yeah.
so good. So for me, it's like I just tell people, it's just like, again, build your immune system. That's one of the best things you can do. Okay, then let's go on to myth number 4. Flu shots are for everyone. Okay, I remember back when I was going to chiropractic school, and we were learning about all of this, and at that time, basically, the flu shot was only for really little and really old people with compromised immune systems. Okay, now it's like everybody. Okay, and there's multiple. I mean, it was like there used to be just a flu shot, then there was a double flu shot, and then there was a trivalent 3 shot. Now it is a quadvalent 4 different ones. Like, and I can understand from a scientific standpoint, it's like, well, there's 4 different ones, but let's go back to 1, 2, and 3 again. Okay, if you can't tell and it's already mutated, then why are we doing that? The only answer that I can come up with is that somebody is making money doing this, okay? And that's the big thing right there, because every year there's more. It's like I feel like I'm being upsold every single year, you know, let's go to the supersize shot, okay? So it's like, it's just more and more. And again, I don't see the benefit for that. You might, but again, it's like, has anybody else heard that before too? It's just like, why is it before was just for just a select group of people, and now it's more people, everybody, okay? So that to me, it doesn't make sense to me, okay? That's just me, okay? So let's go to myth number 5. Flu shots are free. Gang, it's not free. We're paying for this, okay? So please, when somebody tells you, oh, they're free, you know, when you see advertised free here, free, no, somebody's paying for that, okay? They have either the government's paying for that, it's your insurance company is paying it somehow, or you're paying for somehow. So again, there's no free shots out there. These companies are not making these things for free. They're a for-profit industry. They're getting paid somewhere, okay? So don't think of them as just free, okay? Somebody's paying for that. All right, so let's go to some ideas that we can do to maybe not, you know, if you're kind of like me, it's like, what do you do if you don't get a flu shot? Well, here's the best thing you can do. Why don't we build our immune system? Make it stronger, okay? Is it a guarantee that you're not going to get the flu? No, it's not. What if the severity is a whole lot less, though? I mean, I've gotten the flu in the last couple of years here, and again, it lasts for a day and it's gone, okay? My body, like, hey, got that one, I know what to do. Okay, so, and it moves on. Same thing with like a cold. Again, viral and bacterial. They're everywhere. Everybody's going to get sick. If your immune system is low enough, it'll get sick. But let's do some things that will build it up. So what I recommend that people do, if they have that, and there's a lot of different ways to do that, but my best way of doing it is what I call a antiviral herbal tonic. This is a great combination product by MediHerb. And I tell you what, I took some of the information here from this book right over here. It's the Principles and Practice of Phytotherapy by Dr. Carrie Bowen and Simon Mills. And again, those 2 herbalists have done an extensive amount of research. This is their 2nd edition, and this is like the textbook that they use in medical schools. So this is good information. I want to just kind of give you an idea, because when I make this antiviral herbal tonic, it has 3 ingredients in it. And I want to read to you the different ingredients and then what do each one of these things do. So the first ingredient in there is Echinacea root. Okay, you want the root because that's where the medicinal, can't even say that word, medicinal properties are, okay? So this is what it does. It has an immune modulatory, which means it builds the immune system up. It has anti-inflammatory, vulnerary, which means wound healing. It is a lymphatic adaptogen, which means it stimulates the lymphatics. That's where your white blood cells run through. Okay, that's like their superhighway. It's antibacterial and antiviral. So, good one, okay? The second ingredient is St. Johns Wort, which I think a lot of you have heard about before too. St. Johns Wort is a nervine, which means it calms the nerves. It's also an antidepressant, but it's only for mild to moderate antidepressant. It's a vulnerary, again, it's for wound healing. It's antiseptic, and it's antiviral. All right, so there's another antiviral right there. And then the third one is basically licorice root. Now, licorice root is an anti-inflammatory. Listen, this one's got a lot. It's anti-inflammatory, mucoprotective, so it protects the mucous membranes in the throat and lungs. It's an adrenal tonic, so it helps with energy, like the adrenal glands. It's an expectorant, so it helps get things out. It's a demucent, which means it relieves inflamed or irritated tissues in the body. It's a mild laxative. It's anti-carcinogenic, which means it helps prevent tooth decay. Well, that's really neat. So I drink this stuff all the time. I had no idea that it was helping prevent tooth decay. It's also antiviral. It's an antitussive, which means relieves cough. It's a spasmolytic, which relieves smooth muscles in the lungs. And then it's hepatoprotective, which means it helps protect the liver. So that's a lot for the licorice root. Okay, I thought the other two did a great job, but that was even got more. So those three herbs, again, basically for antiviral and antibacterial. So you're getting coverage on both ends when you take this. And, herbal, or I should say antiviral herbal tonic right here. So here's like the 200 milliliter bottle, so you can get something like that. Or here's like a 50 milliliter bottle of that, antiviral herbal tonic. Okay, you can get that here from us. So that's something that works really good. So, boy, that's a lot of coverage right there. That's a lot of information. And I know that, again, like I said, this topic is one of those ones that, it's kind of, polar. People are like either for or against like that. And again, all I'm asking you to do is create a conversation here. We want you to understand, okay, you have choice. Okay, it's not like you have to do one or the other. Sometimes I tell people, it's like, well, if you're really that worried about it, like, why don't you do both? Okay, or if you want to try this and see how you do for the entire season and see if that gets better for you. So again, I just want you to understand there's more than one thing you can do. There's a lot of things you can do to build your immune system and make you stronger year after year, because again, the best defense against all of these things is your strong immune system. So next week on the Wellness Connection, Michelle is going to be behind, well, actually, I'm going to be behind the camera, and she's going to be out here in her kitchen, and she's going to be making some, because it's the day before Halloween, and she's going to be making her chocolate bark, which is a nice healthy one. So when you see what this is like, this is a great recipe, great to hand out for the kids and stuff for Halloween. That isn't going to cause problems with their immune system. Okay, so that's what we're going to be doing next week. So I hope you enjoyed our show. I hope you got a lot from it. And again, I really appreciate you watching and commenting and putting your posts up there for me, because that's what I want. I want to hear from you too. So that's it for this week. You guys enjoy the rest of your week, and we'll see you next time.